All right, everybody. Thank you so much for joining us on this fine Wednesday. Today, I have two fantastic subject matter experts with me, Melissa and Ali. Melissa is from our Markham location and Ali is in our Aurora location. So today, we are going to be talking about acupuncture. Acupuncture 101 is the title of today's session, and we really wanted to take the time to educate our community on the diversity of acupuncture, all of the things we can use acupuncture for. There's a lot of myths out there, and we want to debunk some of those and give you guys some real life view into what receiving acupuncture actually is like, and then the different situations that it can be used in a clinical setting. So just briefly, for some of you on the call today who may not know who we are, I mean, most of you, I recognize your names, and I do miss seeing your faces in person. But for those of you who've never visited us before or haven't visited us in a while, Honsberger Physio Plus is all about helping build a better you. So whether you have a new injury or you want to take your game to the next level, or you're just finding it harder to move than you used to, we are committed to helping you live better, feel better, work better, and perform better. We believe that personal empowerment is key to living a healthy life. So if you haven't visited us in a while, the business has grown quite a bit, which is super exciting. We have locations in Markham, Aurora, Burlington, and Stouffville now. And we have a number of private locations, more of our corporate wellness side of our business. We work with Apotex, which is a pharmaceutical manufacturer, Sanofi Pasteur, same thing. We have a location at the Toronto Cricket Club for members only, Ovenbird Golf Club up in Muskoka seasonally, and our newest expansion, William Osler Health Systems over in Peel. We have a huge team and we do a lot of different things for a lot of people, but I'm super proud to say that we have 10 registered physiotherapists on the team, 4 registered massage therapists, 4 certified athletic therapists, 2 personal trainers, 1 osteopath, a certified athletic trainer, a strength and conditioning coach, 2 Pilates trainers, and I got 1 on the phone with me today, and 4 solid administrative professionals who truly make our world go round. So that's just a little bit about who we are, where we work, and our team. And I've got Ali and Mel on the phone with me today. They're truly the subject matter experts. I'm here just to help moderate and ask questions. And for those of you on the line who do have questions, I encourage you either to unmute yourself to ask your question throughout this call, or use the lovely chat function that I will be monitoring throughout this Lunch and Learn webinar. So Mel, why don't you tell us a little bit about yourself before we get started, and then we can ask Ali to share a few things about herself before we get started, just so you know how awesome these guys are and what their background really is.
So as Robin mentioned, I'm out at the Markham location. So acupuncture and dry needling, I've been practicing since 2017, which I guess it's kind of weird to say is 4 years ago, considering we're in 2021 now. So time flies. I typically like to work with the more, I guess, athletic population, but given our clinic, we see tons of different types of clients ranging from motor vehicle accidents, workplace injuries, that type of thing. And I definitely do use acupuncture to help with certain conditions that we will kind of expand a little bit more on later in this presentation. But yeah, that's me, I guess, and we'll chat a little bit more as the presentation goes on.
Awesome. That's a great intro. And then Ali's one of our newest registered physiotherapists. She works in Aurora and she's got the most impressive resume. So Ali, why don't you just share a little bit about yourself, when you started practicing acupuncture, and maybe what your favorite meal is, so we can get to know a little bit more about you as well.
So hello to everybody today. I've just been with Honsberger for about the last 6 weeks, moved from the UK 18 months ago, and I've been a physiotherapist for 30 years now and started acupuncture in 1994 when I was working for the military in the UK. my background is quite mixed. I've worked in high-level sport and been to 5 Paralympic Games and Commonwealth Games with Great Britain and England, and worked in our health service. I've run a clinic myself, and I incorporate acupuncture as one of the tools that I use within my physio. Oh, and my favorite meal, I'm quite keen on curry.
Oh, yeah.
That's a good one.
Right at lunchtime. I'm starving now. Right. So let's stick with the schedule. I love those little bits of getting to know you a little bit better. You know what I mean? I think that's really nice to put faces to names, especially for those who are on the other line or other side of the conversation. So why don't we get started and really talk about what is acupuncture, but also what is dry needling? Because for some of us, it's like, okay, aren't they both the same thing? So really, maybe we can sort of explain the difference between the two. Would that be a great place to start?
All right, so acupuncture obviously originated in China about 2,500 years ago. And traditional Chinese medicine works on meridians through the body, of which there's 12, and they link to each major organ. We use acupuncture for within this for promoting blood flow, decreasing pain, reducing inflammation. And if you're using the Chinese traditional approach, you're using specific points within those meridians, and we'll explain that a little bit more as well. And then a dry needling approach, they're not the specific points that are on these meridians through the body. You generally will use a thin needle with this, and it's points where your muscles maybe are tight or areas of pain, and we're stimulating a sort of a twitch within that area. So often those points are very close to the meridians, but they're not as specific. And that's one of the things that I kind of use a lot within my practice.
Cool. That really sort of helps me understand the difference. That's great. Now, sorry, I've got to silence this device over here. And that's one of the reasons I have terrible posture and am coming to see you guys later on today. So really, what's the difference between acupuncture points and motor points and trigger points? Because when I hear points and all those names just kind of blend together. So maybe we can kind of help decipher what the difference is between all three of those different things.
Yeah, for sure. And as Ali kind of touched upon briefly with the meridians, so with acupuncture points, they're points located on those meridians or channels. And like Ali had mentioned, they correspond to certain vital points in the body. So if any of you guys have Instagram, I made a post on LI4, which is the acupuncture point, large intestine 4. So obviously LI corresponds to the large intestine meridian, and the number 4 corresponds to the point in which it falls along that channel there. So like Ali had mentioned, that's typically used in more traditional Chinese medicine. Motor points, on the other hand, are typically used in dry needling sessions, where it's a small area of the muscle where a minimal amount of electrical stimulation or needle stimulation will cause the muscle to twitch. So that's where you get that local twitch response in the muscle. So if you're doing any sort of motor point dry needling and you feel kind of the muscle jump a little bit, that's why you feel that. On the other hand, you have trigger points, which are a sensitive area in the muscle that causes like generalized and sometimes diffuse muscular aches and pains. And we refer to that as like muscle knots. So we also do dry needling along trigger points as well to help release any sort of tightness in the area and also help reduce pain as well too.
Now, question for you. Can you use both at the same time?
Oh, yeah, for sure. You can use all three. So you can do needling for acupuncture points, motor points, and trigger points all at the same time. Okay. Triple whammy.
Yeah, plus some of that manual therapy all at once. And I'm sure we'll get into that later when we really talk about using it in our practice. Cool. Okay. I didn't know that. So that's awesome. Now I know there is a lot of misconceptions out there regarding acupuncture. People are scared of needles, but you know what I mean? There's just so much uncertainty or confusion out there. So maybe we can talk through some of those common misconceptions and really help to clarify that for some of our attendees.
So there's various ways and regulations that you can practice acupuncture. So as physiotherapists, within our general training, we don't learn acupuncture. It's something that we do as a course after we've qualified. If you become a full acupuncturist, you maybe would use acupuncture in the traditional sense for treating all sorts of things. So you may have heard of people using it to lose weight, to treat different conditions, but within physios, we train to use it within the musculoskeletal setting. It comes as part of, as a physios, we maybe release muscles, we maybe work on rehabilitation in it. So it's one of those extra tools that we can use when you come for treatment. So you may come and have physio, you may have some exercises to go away, we may do some manual therapy. So it comes under the physiotherapy umbrella, as long as that therapist is trained with the right regulator. And lots of professions can do that as well. So it's important that you know what training they've had and what parameters they're able to work within.
Now, does acupuncture hurt?
Coming from personal experience, the needles are very, very thin. So it actually, I find that it hurts less than, let's say, if you to go get your flu shot, right? So depending on the area that you're working on with acupuncture, dry needling, whatever it may be, I find that the areas where there's a lot more muscle bulk, it's definitely a lot less painful. When you get into areas where there's more sensitivity, like your hands and your feet, I find that those areas tend to pinch a little bit more. But overall, the experience itself, what you should feel is maybe sort of a dull kind of ache where the needle is, but it's not, excruciating sharp pain. If there is, then chances are you're on the wrong spot and you need to kind of readjust the positioning of the needle.
But that's why you guys are trained, so you don't hurt people. I hope. No, that's really interesting. So when we talk about the needle, like actually going in, you might feel it then, is that correct? But it should dissipate over time, depending on how long you leave that specific needle in any of those points. Is that correct?
I find within like the first 3 to 5 seconds. So you get that initial prick and then it goes away after like 3 to 5 seconds after you leave it in there.
Cool. And would you say the same thing, Ali?
You can, and some of the sensations that you may feel while the needles are in are sort of like an aching sensation, or sort of warm sensation, a tingling. So those are some of the responses that people feel when the needles are in.
Cool. Now, for example, we were just talking about like LI4, which I believe goes right in here or here. Yeah, right here. So will I feel a sensation somewhere else in my body? Because you were saying that even though the trigger point is here, it works on other sort of injuries or pain points. So would you feel relaxation or any sensation in other parts of the body?
Oh, definitely. Because with certain acupuncture points, as we kind of discussed before, it falls along a channel or a meridian that runs through the entire body. So depending on which meridian you're working on, you can feel just in a general sense of sometimes feel like a little bit of a rush. Sometimes you feel a little bit of achiness in different areas because it kind of connects from one area of the body to the other. And that kind of ties into another misconception that people have with acupuncture, is that it only treats more physical pain. But this is kind of going into the traditional Chinese medicine aspect of it, where it's also effective with other systemic health conditions like mental and emotional health issues as well too. A little bit of kind of a little tidbit here, but there's a point that's right between your eyebrows, so right over here. It's called the yin tang point, and if you were to needle this area here, it actually helps with any sort of nasal congestion, sinusitis, things like that. So there's different points that affect various areas of the body that are kind of a little bit of voodoo people. You know, you wouldn't think that if you were to needle one point in the area, it can affect different aspects of the body. So that's definitely something that you can feel for sure.
And just adding to that one, this is a really good point. Like, you can use it as a pressure point for people kind of, so if you feel faint, so it's one that my daughter's always using because she hates needles and things, but like a good pressure point there.
It's one of the needle points. I remember 2 years ago, I was going through a particularly stressful time, and I came into the Aurora clinic, and our clinic director at the time just saw how tense I was, and she put me in a room, and she went through a number of different acupuncture points, perhaps on my face, and she closed the door and told me to stay put for 30 minutes. And quite honestly, I came out of the room a different person, you know what I mean? Just in terms of like the amount of tension I was holding. So for me, even from talking about alternative uses, whether it's musculoskeletal or not, the stress aspect for me was monumental. So I wanted to share that personal experience with the group as well. Now, in terms of the evidence behind acupuncture, obviously this practice and this modality dates back far, far longer than most of us have been alive. But how does it all work, if you guys can sort of help us understand that?
Yeah, so like you said, it's been around for a very long time, but it's only been recently that there has been a lot of, I guess, clinical studies in the Western realm, so in North America and Europe, because like you said, it has been practiced for a long time in Asia. In one of the studies that I found done in 2008, kind of tying more into physiotherapy, they were evaluating the tension neck syndrome, so just tight and stiff neck, in combination with physiotherapy. So how people do with acupuncture plus physiotherapy treatment. So in the first group, they received acupuncture and physiotherapy treatment. In the second group, they only received acupuncture treatment. And in the third group, they only received physiotherapy treatment. So that way you can kind of get an idea of how each specific groups affects their symptoms. So overall, all of the groups showed significant improvement, but group 1, which is the group that received both acupuncture and physiotherapy treatment, they were superior to groups 3 in terms of pain and functional disability. And group 1 was also superior to both groups 2 and 3 in developing neck strength or improved neck strength. So based on this data, acupuncture and physiotherapy in combination can enhance the rehab process in, I guess, in this specific study, the tension neck syndrome or stiffness in the neck and things like that.
Interesting. I think that's pretty cool. How would you guys evaluate if someone is a good candidate for acupuncture?
I guess Ali can talk about this. We've been working on a pre-screen for individuals to come in to see if they'd be a good candidate. So I'll let Ali take the floor with this one.
So it's no different in terms of sort of like, so when we do a physio assessment, we're finding out what's wrong with somebody and then thinking about what are our best tools that we can do to help that person resolve their problem and kind of move forward. So acupuncture is one of those. So I guess we're going to talk a little bit more about this as well, but one of the things that I would think, that somebody's good for acupuncture would be if they're in a really acute pain and thinking, what can I do that, I maybe can't get into them with my manual therapy, they can't exercise, they can't move. It may be good as a sort of settling down their acute pain. And one of the other things that I would think of as well is, and I guess Robin touched on this as well, when she was like really tight through all those muscles and things, acupuncture is a really easy way and to settle everything down before then you think about doing some other things. So if I'm thinking, well, I've got some trigger points or some really tight muscles, but I want to actually get in and release those tight joints, and maybe we'll think about, well, it's useful to needle that first before I then go into doing some other physiotherapy techniques. But there are obviously some things that we need to check with people. And so if somebody got a needle phobia, that's probably not a good candidate for doing acupuncture with. You know, if you're on blood thinners and prone to bleed and bruise, then that's somebody else that we wouldn't. So you'd think about the whole medical history as well within that.
Just to briefly add to what Ali had mentioned, definitely all things considered, we want to make sure that the candidate is someone that is appropriate for physiotherapy, as well as just to kind of a little tidbit here is that some of the acupuncture points actually induce labor. So especially in women who are pregnant or suspected to be pregnant, we definitely screen for that as well too, because that can definitely be a red and yellow to look out for depending on which points that we decide to use.
That's great. And that's why you guys are trained and know these things a lot better than we do. But that's interesting because like we were talking about the different uses of acupuncture, that's not even something that I would think about. So maybe some of my friends or anybody I know who really want to get that baby out of there, you can go to an at-home visit or go to the hospital and really help out there. So maybe that's something people can keep in their back pocket. I don't know if that's advisable, but we'll just throw that one out there. Now, I'm going to ask this question. It might be better suited for question number 5. And if you guys want to push that forward, that's fine. But does acupuncture help with nerve pain?
Definitely. So nerve pain, nerve impingement, a lot of those types of conditions, we definitely use acupuncture and dry needling for. In addition to that, there's conditions such as arthritis. So both rheumatoid and osteoarthritis, we typically use to help with managing inflammation. Going back to the stress and anxiety, headaches, migraines, those would be things that we would, or symptoms and issues that we would typically use acupuncture for, as well as, you know, your common musculoskeletal types of aches and pains as well too. But going into, I guess, more of the neurological realm, I was looking into a couple research studies taking a look at acupuncture and its effectiveness with pathologies such as stroke and Parkinson's and things like that. But the evidence was pretty inconclusive in helping treating the, I guess, functional disabilities of those neurological conditions. So I know that there are practitioners that, I guess, help those individuals with those neurological conditions. It's just that I couldn't find anything in terms of peer-reviewed evidence and studies that kind of confirm that. But that's not to say that in clinic, you don't notice any of those positive results.
Now, sorry, Ali, did you have something you wanted to add on that topic?
Yeah, just in terms of, I think we haven't really explained. So one of the things that acupuncture does, and it's sort of well researched, particularly from a Western side of things, it stimulates your endorphins within the body. And so your endorphins are your pain relieving substance. So lots of things do that in terms of medication and that. So if you're thinking about nerve pain or pain within sort of any systems, that's one of the big things that acupuncture helps with, by sort of changing how the nerves are responding, and then they're releasing the endorphins, which sort of is well-being and reducing the pain.
That's really helpful for us to understand. Now, how about we dive a little bit more into how we actually use it in our practice? Because I think a lot of the other questions that people are asking may be answered by revisiting this question.
Is that me, Melissa?
I'll let you go. If not, then I can
Okay.
put in my 2 cents in.
So I think we're going to go to the case studies now. We got
Sure. Yeah, absolutely.
kind of in terms of our practice.
For you guys on the for Mel and Ali, I know there's 2 images after this. So if you want me to switch to any of those and then the video, just tell me when that you want me to put that on the screen.
So if you could put the picture on with the calf with the needles in.
Yes, absolutely.
Well, so we can do this one to start with. So we thought it'd be helpful just to, for people to have an idea. So depending on what part of the body we're needling, there's different sizes. You can see the end is the little handle that we use so that every needle is sterile and wrapped, and we don't reuse them. And the end is a little handle, and that's what we hold to put the needles in. They come in a sort of little holder, but you can see like that the lower one on the screen, that would be likely the one that we would use in the L4 that we described earlier in the thumb, because obviously it's not very going to go so deeper in, whereas the top one you'd maybe be doing more in your sort of buttock area because there's lots of deep muscles to get into. So one of the examples that I've used, we tried to give sort of opposites so that you get a bit of a feel for how acupuncture can be used in very different conditions. So I've worked a lot within sport. One of the athletes that I worked with was training. He was a cyclist and sort of felt twinges within his calf. Now you could think, well, that was like a mild strain, or is it just tightening up? And he had to compete the next day. So we didn't want to be aggressive with him because he needed to compete. So I did some dry needling with him, and also some trigger point needling and one of the acupuncture traditional medicine points to be able to release through his calf. And then sort of worked after that with some stretches, and then the next day he was able to compete because it wasn't actually a muscle tear, it was more sort of tightening and just spasming but feeling like that. And I think we've got a picture to kind of show where those needles were within that. And so it shows the sort of, this is a video of them going in, so it sort of gives you an idea of how the needles go in.
Perfect. So I'm going to play that for everybody now, just so they can see that, and then we can jump to the next.
So you can see the guide tube that we use. And then you sort of, I'm twizzling it to go in. So I'm holding that handle at the top. So this was, I was doing some needles around the Achilles.
For a while, I thought this was somebody's neck because I didn't see the top part of the video.
Yeah, so it's just going to show you a couple of needles, and then we'll show the picture of sort of how I then did the whole calf, and it incorporates a mixture of all the things that we're talking about with traditional medicine, motor points and dry needling.
So I do apologize because I missed that picture, and that's on me, and I apologize for everybody on the phone. I'm really sorry, Ali. I missed that photo. So I've only got these 2 images here, but maybe we could try to describe it for everybody. And then what I can do when I send the presentation to everybody, I will include that third image. So I do apologize for that.
So if you imagine a calf, I've dry needled around the Achilles, and then there were some trigger points in the calf. So when you see the picture, there's needles within that, and then on the outside of the calf, there's a traditional Chinese medicine point that links specifically for releasing muscles and tendons. So I sort of combine the whole lot in that.
and I will send the picture to everybody again. I apologize for that. Now I know, Melissa, you had another case study that you wanted to share with the group, so you could really talk about how we use acupuncture in our practice. So maybe we can kind of dive into that one.
Yeah, for sure. So, as I mentioned before in this study that took a look at how acupuncture in combination with physiotherapy really does help improve symptoms in individuals. So I typically use acupuncture in combination with other physiotherapy techniques such as manual therapy, as well as exercise prescription. So very rarely do I just have a session where it's just acupuncture. A lot of the times it's in combination with a lot of the other techniques that we do as well too. So my specific case study was working with a 63-year-old female. So she's been dealing with chronic rheumatoid arthritis in her hands. So she complained a lot about pain and inflammation and stiffness in both of her hands, more specifically in these knuckle joints here. So first time I saw her, her hands were pretty red, inflamed, not a lot of mobility in the hands. So what we started off with was weekly sessions. So we started off with 4 weekly sessions of the acupuncture along with manual therapy. And we noticed that in those 4 weeks, in those 4 sessions, her pain and inflammation has decreased, and she noticed a lot less stiffness in her hands. And a lot of the times with acupuncture, some people may think that, you know, it's something that will work a miracle and things will be better immediately. But what we're looking for in terms of our progression and improvement is that it kind of slowly symptoms and she's able to have more functionality in her hands progressively and slowly. So that's what we're working on now. And now we've kind of decreased our sessions to every 2 to 3 weeks or so, just to kind of manage and maintain the gains that we get and kind of keep the inflammation at bay.
That's great. Now, so what I love about this technique is there are so many different applications. Ali touched on athletes, recovery, muscle tension, and that's one thing that's sort of really a part of our DNA as a business is working with athletes, helping them achieve optimal performance and really preventing injury. But then Mel's also talking about injury recovery and that rehabilitation side, which I think is really neat because it's not just going to impact one small group of clients. Now, Mel's done a number of great Instagram posts and Facebook posts about different acupuncture methods. And I know we can also work with people who've had motor vehicle accidents, but also there's been a lot of chatter about acupuncture and concussions. So I'm wondering if that's something that you guys might be able to share on how you might use acupuncture to help people recover from any mild traumatic brain injuries they may have experienced.
I guess speaking on my own experience with a concussion, a lot of the times it's as a result of a head injury or trauma, which causes the head to either move forward or to the side in a very quick direction. So a lot of the times with concussion symptoms, you also have a lot of neck pain, neck tension as well as a result of the whiplash. So I find needling along the neck definitely helps release those tense muscles, especially considering that they attach up to the base of the skull. They can really contribute to tension headaches. So I found that that has really worked well in the past. And in terms of as well as behavioral symptoms as a result of the concussion too, needling certain points that help decrease the stress and the anxiety, as you were kind of explaining with your past experience, Robin, that definitely helps with their mood as well too. So I mean, that's been my experience with concussion patients. I guess Ali can speak a little bit on her past experience as well too.
Yeah, I think I'm pretty similar to Melissa in terms of using it for sort of headaches and neck pain and releasing on those sort of tighter areas. So similar thinking. That's
great. It was just sort of, I really want everybody on the call today to understand how broad this technique is. Now, if there is, I guess the last question someone just asked on the chat here is, Mel, I know you provide cupping. Have you ever used acupuncture and cupping together?
Yeah, you actually can. So you can either do it separately, like one after the other, but there's also a technique where you have the needle into either the trigger point or whichever point you're using, and then the cup kind of goes on top of the needle as well too.
Oh,
So
wow.
that's a technique that can be used as well.
Oh, that's interesting.
Yeah.
That's a triple whammy, because then
Full whammy,
you got
exactly.
those little muscly arms in me as well. You know what I mean? That's really asking for it.
Yeah,
That's
exactly.
fantastic. That's really cool. Now,
Mhm.
Ali, from your experience, if there was one thing you could share with the group today about acupuncture, but also your practice and sort of people taking that preventative care approach, would you give anybody one specific tip in terms of injury prevention and performance that you'd like to share?
So particularly because of my background with athletes, when you work in high level sport, you actually work in a way in reverse of a lot of physio. So we don't wait for injuries to happen. At the start of the season, we screen athletes to look at how their body's moving and try and put things in place to reduce sort of their injury risk. And I think there's a lot of benefit in coming for physio to try, particularly if you're sort of into sport or different activities, to try and think, well, are there areas that I maybe can work on in my body to improve things, so then I don't end up having an injury and losing time in sport or doing my garden or enjoying my time at the lake in the summer, so that and you don't need as much physio.
Absolutely. And I think that would apply to every single person that comes into our clinic. And one thing I know Kevin speaks about a lot is 90% of the injuries we see are preventable. So adopting that sort of same mentality that we have for our vehicle, where we take care of our car, we go for regular oil maintenance. That's, I think, the same analogy that Ali's trying to articulate. So whether you're competing in the Olympics or in a professional element of sport, you're a weekend warrior, or you're just sort of a regular Joe or a regular Jane who's working and trying to live their life, that injury prevention and that sort of pre-rehab, so that you don't actually have to do the rehab, I think is really what Ali's trying to chat about there. Melissa, would you sort of say the same thing, or do you have one kind of quick tip for everybody on the line that you really think is critical for longevity and empowerment?
Yeah, I'm totally on the same page as Ali with the screening, because like you said, a lot of people don't really know that things are kind of building up over time. A lot of the injuries that we see, like you said, are preventable. Even after following recovery, we do encourage regular maintenance sessions to prevent things from getting worse, and that we catch things a lot earlier on, which is a lot easier to manage than, you coming in 6-7 weeks down the line when you're actually in pain. So a lot of the times people come in and they say, I actually feel fine. And it's not until, you start working on them and you actually start to find things that are tight. Maybe the alignment's not that great. And those are the precursors to injury. So if we can catch that earlier, it'll save you a lot of grief.
That's awesome. I know I'm a huge proponent of that sort of preventative maintenance kind of idea. Now, I guess there's one more question. I know we kind of talked about if you're pregnant, you shouldn't necessarily receive acupuncture, but are there any other risks that we should know about?
Ali kind of touched on a few of them with the anticoagulation medication. And I guess going back to your point with pregnant women, it's not that they're not allowed to receive acupuncture. It's just that you have to be wary of certain points that may induce labor. If there are points that will not affect that aspect at all, then it's perfectly safe for them. Another thing that I can think about that might not have been discussed is if you're doing any sort of acupuncture with electrical stimulation, you should be screening patients who have pacemakers, because that is a definite contraindication. So that's why we go through our screening, just to make sure that it's safe to move forward with that treatment.
That's super helpful for us just now. And I know that you guys do this screening actively in your sessions. This is more just to educate our community on sort of what you do look for when you evaluate if someone might be the right candidate for acupuncture. So guys, I want to thank you so much for sharing your insight. And I also wanted to share with the group here that if you guys have any specific questions for Melissa or Ali that weren't answered on the phone, or you want to talk in a little bit more private environment, maybe you're not comfortable asking in a group setting, Melissa and Ali's email is listed below. Melissa with one S at honsbergerphysio.com and Ali at honsbergerphysio.com. Ali is with us Monday, Wednesday, Friday in Aurora. She's phenomenal. She knows her stuff, and she's, like I said, got the resume to prove it. So if that works for you, I strongly encourage you to hop on to that preventative care bandwagon and really make sure that those injuries don't happen. Same thing with Melissa. She is in Markham and will be expanding her schedule to Stouffville shortly. So we do offer acupuncture, dry needling, and those modalities in all of our locations. So you know what I mean? Don't wait. When in doubt, get it checked out. And these ladies truly know their stuff and can definitely educate you and give you the background if there's any more questions that you might have. So unless there's any other questions from the group, let me just check here. Speak now or forever hold your peace, all of our attendees. I'm just kidding. We're here no matter what if you have questions. But again, big thank you to both Melissa and Ali, and I wish everybody a great day. And like I said, when in doubt, get it checked out. Don't wait to get hurt to come and see us. Thank you so much, everybody, and I hope you have a great day.
All righty.
Thanks, everybody. Take care.
Thanks.